Hi, my name is Tamera Gavilan. I'm 51 years old. I am a USC County grad from nursing school. I graduated in 1989. I am currently still practicing as an RN. Around November, the fall of 2011, I started to have some really bad upper right leg pain. There was no trauma. I wasn't in any accident or had a fall. So we really couldn't figure out what the pain was being caused from. I was referred to Dr. Shamie. He was one of the few surgeons here on the West Coast and at UCLA that did the sacral fusion.
Tammy came to see me with this pain in her lower back. Was specific about where the pain was stemming from. It was coming from not the middle of her back, but just to the side of the middle of the spine. They oftentimes come in with what's called a Fortin sign, and they put their finger right over the PSIS, and they tell us that this is where the pain's coming from. This is where it's emanating from. After she told me about her symptoms and she gave me her history with specific maneuvers for sacroiliac dysfunction, along with the other examination maneuvers that I did, I was able to clearly identify the sacroiliac joint as the main source of her pain. So I referred her for a SI joint injection. I then ended up discussing surgical options with her.
In June of 2014, I went through the first sacral fusion. The surgery went well, had a few months of using a walker. Surgery was always my last option. Now looking back, it's probably one of the best things I could have ever done for myself. And I think that because of this surgery, they've really given me my life back. After years, if you've been a person who has suffered from back pain for months into years, it can be very debilitating, and it's something that you wake up with and you go to bed with. So I was that person. I had the pain. It was a very debilitating time. And because I took the chance and I listened to everything that Dr. Shamie had to say, being a nurse, you know, you're always, I'm skeptical about surgeries and what if they don't work. But if I had to do it all over again, I would. I would say for anybody who's experiencing that kind of pain, who can't think about maybe where the next relief is going to come from. Am I going to be able to do something with my family, or am I going to be in bed for 2 days afterwards? I'm going to say do the surgery.
You know, it was really a pleasure taking care of Tammy. She understood her condition. Once I explained to her that SI joint dysfunction is her problem, it was really easy to go down the path of treatment with her. And now she's basically not having any SI joint dysfunction pain, and she's able to go back to work and take care of her own patients. So it's really exciting to see her recover and do so well.